Type 2 diabetes is a complex disease, and it really requires a team effort in order to manage it. It's more than just blood glucose control, which is clearly very important, but the other cardiometabolic risk factors necessitate other specialists brought in as needed. Cardiologists play a key role in terms of cardiovascular disease, which is the leading cause of death for people with diabetes. Kidney specialists for complications related to renal disease, ophthalmologists, diabetes educators, dietitians. Really a team effort is required to be able to manage the disease. And most importantly, it's the role of the primary care physician who brings that whole team together under the medical home.
We cardiologists take care of a lot of patients who have diabetes and other metabolic diseases. In fact, if you have diabetes, you have about twice the risk of an adverse outcome if you have heart failure or you're following a myocardial infarction. And so we need to engage other clinicians, endocrinologists, primary care physicians in the care of these patients. I don't generally prescribe anti-diabetic medications myself, for example, but I like to know what's happening to my patients who are taking anti-diabetic medications, including insulin, and I like to work with the clinicians that are also treating them, such as endocrinologists, diabetologists, and nutritionists even, other care providers, not just physicians who are involved in managing these patients who have metabolic risk. I have a lot of patients who are obese. Obesity is obviously an incredible risk factor in patients with heart disease in general. And many of my patients will say, I've tried to lose weight and I don't know how. So we refer to them to nutrition. But it's, I think, incredibly important that cardiologists have the resources to around them, the other clinicians who can help them take care of these patients in a holistic way. Patients with diabetes, patients even who have pre-diabetes, who are predisposed to diabetes, are at markedly increased risk for cardiovascular disease. And this includes myocardial infarction, and it includes heart failure. In fact, we see a lot of patients who develop the syndrome of heart failure with preserved ejection fraction, who have diabetes. They might have a little renal disease. It's impossible to take care of their heart alone. And so we really have to think about the entire patient. Managing their glucose, again, it's not something that I do as a cardiologist, but if I knew that a patient of mine had glucoses that were out of control, I would want to treat them differently. These patients almost always have elevated cholesterol, so they need to be on good lipid management. Generally, that involves the use of statins. If their LDL doesn't go low enough, we can use drugs like ezetimibe as well. And of course, there's excitement these days with the PCSK9 inhibitors for patients who either have very severe hypercholesterolemia or are truly statin intolerant, and then we can consider other options.